Welcome to Common Sense Care, parenting your gender-confused children with truth and love. So-called affirmative care is the gender industry's one-size-fits-all treatment plan for everyone who struggles with their identity. In no other area of education, psychology, or medicine is a one-size-fits-all treatment plan suitable for every person. At Partners for Ethical Care, we believe that each child is an individual and should be given the care and treatment that's most appropriate for him or her. So welcome back. I'm Maria Keffler.
And I'm Erin Brewer. And what's the topic for today, Maria?
Today, we're going to talk about depression and gender dysphoria.
I think it's a really important topic because one of the things that I hear over and over and over again is that these children need to be allowed to medically transition and socially transition in order to deal with depression. And so I'm hoping one of the things that we can address in this episode is that connection between depression and gender identity issues, but really point out that a transition is not an appropriate treatment for depression.
Yeah. Unfortunately, what often happens, not just in the gender industry, but in all kinds of research, all kinds of care, people mistake correlation for causality.
Yeah.
And we've talked about this before. You mentioned this fact that when sexual assaults increase, we also see an increase in ice cream sales. Well, can we say that ice cream causes sexual assault or sexual assault causes people to want to eat ice cream? No, we can't attribute any causation there. The reason those two things are correlated or happen together is because they both happen in the summer. In
Right.
the summer, more people are out and about, and so there's more opportunity for sexual assault. But in the summer, it's hot, people like to eat ice cream. So those two things both increase, not because they cause each other, but because there's a third factor happening, which is that it's summertime.
Yes.
And
And
so,
one
go
of the
ahead.
one of the things that I'm really grateful for is some recent research. Brandstrom and Pachinkas actually did some research, and initially they came out with a study saying that medical transitioning, specifically surgeries, help with depression and have better mental health outcomes. But some concerned scientists looked at the results and at the data and really were questioning because the researchers in this case had an agenda. They were very pro LGBT. They were very pro transitioning. That was, they wanted to do a study to show that it had positive outcomes. But when outsiders looked at the data, they actually questioned it, and they wrote into the, I believe it was the American Psychiatric Association journal, and so that they questioned the conclusions that were made based on the data. Well, the journal asked the researchers to reanalyze the data based on the concerns that were raised. And lo and behold, it turns out that cross-sex hormones nor surgery help with depression, that actually the mental health outcomes were worse. And we know that the suicidality goes up based on previous a Swedish researcher who looked at longitudinally and saw that within the first, couple of years, the mental health outcomes seemed to be about the same. But when you got about 10 years out, the suicide rates among those who had transitioned versus the general population were about 19% higher. And those were completed suicides. So that's not just someone who had suicidal ideation. That was someone who actually completed suicide. 19 times higher is profound. I can't think of any other mental health issue that has that high of a rate of suicide. So we've got some really good evidence to suggest the transitioning actually exacerbates the depression and suicidal ideation. And again, we have to be careful here because we're not experts. Every child is different, as you said in the introduction. So this is sort of our what we're doing now is talking about the information we have, concerns that we have, and trying to give our best advice based on the information that we have.
Yeah, and I think the takeaway that we really want to give people is not to buy into your child is depressed, your child wants to transition genders, therefore you must transition genders to deal with the depression. That's a non sequitur.
Right.
They do tend to occur together, but the gender dysphoria co-occurs with a number of different mental health issues. And you have to ask yourself, is the mental health issue exacerbating the gender dysphoria? Is the gender dysphoria exacerbating the mental health issue? We don't have good answers to those questions, but we know the answer is not because your child is depressed, you need to transition genders. We know that is not the answer because research is not supporting that.
Yes, and actually, I have had some significant concerns. And again, there's no research to back this up, but it's just sort of some observations that I've had, that a lot of the children who are depressed, they are put on antidepressants prior to taking on a transgender identity. One of the side effects of antidepressants is a reduced libido. They're actually, this is something they put on the warning labels that you're likely to have a reduced sex drive. Now, some parents might think that's wonderful for teenagers to have a reduced sex drive, kind of relieves some stress surrounding what the kids might do. But in reality, it's that sex drive that really helps kids kind of overcome gender dysphoric feelings, because they start to kind of get in touch with themselves as the sex of their sexed body, and become more connected with themselves as those urges come up. And so I have some concerns that the antidepressants that are being used to treat depression could actually set a kid up to be more susceptible to the transgender cult and the message that they're giving. Another
That's
thing, oh,
so,
go ahead.
I was going to say that's so interesting. I've never thought of that, but I was on an antidepressant for about a year after one of my kids was born. I had postpartum depression. It manifested in rage, and I didn't know that that could be a symptom of depression, but I did. I would just have these explosive rages. And the doctor put me on a pretty strong antidepressant, and it just took all of my emotions down. Now, I've talked to some therapists since who said you were probably over medicated. You probably should have been on a lighter dose, because I just didn't feel anything, including a libido. But I was so relieved to be not experiencing those rages, and I was able to parent my kids. And I was like, let's not mess with the dose. I'm okay with it. But I had no libido at all for that year. And this is probably more information than our viewers want, but when I got off the antidepressant, the libido came raging back, and my husband said, "Oh, I missed you. I really missed you."
Yeah, and that's, I mean, again, parents are uncomfortable a lot of times thinking about this with their kids, but that sex drive is an important part of puberty. It's an important part of connecting with the body, and if that's suppressed, then it can really, I think, cause some difficulties for these kids who are, their peers are all experiencing these feelings, and they're not. It can make them feel different. Another concern that I have, and I'm just going to read this. This is from the FDA, that being on antidepressants actually increases the risk of suicidal thinking and behavior in children's and adolescents with major depressive disorder and psychiatric disorders. It is really confusing because you're using an antidepressant because a child potentially, a lot of times, is suicidal, and yet they've found that the antidepressants can increase suicidal thinking and behaviors. It says that you should balance the risk of increased suicidality with a clinical need. And in fact, it notes that among the major antidepressants, only Prozac is approved for treating depressive disorder in pediatric patients. That's the only one. No other antidepressant is approved for use in children, and yet they're often prescribed off-label, just like the puberty blockers, just like the cross-sex hormones. And I just, it's really difficult because you have to weigh the pros and cons. If you have a child who is self-harming, is profoundly depressed, it's really important to get, to to stop that behavior. But at the same time, sometimes I'm worried that the cure might be exacerbating some of these issues. So I would just recommend to be very cautious about the use of antidepressants in children. I think that we have a generation that is prone to over medicating, that oftentimes parents are so concerned about their children having uncomfortable feelings that they're prone to medicate, when in fact a lot of what's going on is just normal childhood and adolescence. I think those of us, who had rough childhoods will admit that. I mean, I have no doubt that if I were a child today, I would have been put on a heavy duty antidepressants. My mom actually kept trying to put me on antidepressants when I was in high school, and she would say things like, um, if you were a diabetic, you would take insulin, wouldn't you? And
Mhm.
she would kind of almost try to guilt me into taking the
Mhm.
antidepressants. For some reason, I just did not want to take them. I was very opposed to it. Um, and I'm really glad. I'm glad that I didn't take them. I
Well,
think
with my experience, I did not want to take antidepressants because there is some history in my family of self-medicating
Mhm.
through problems, and I didn't want to do that. But my healthcare provider felt very strongly you need to do this for the sake of your kids.
Right.
So I told my doctor, I said, I'm going to do this for a year and then I want to get off of this antidepressant. And I'll tell you, I went to a psychiatrist and he was very reluctant to let me get off of the antidepressant. He just kept trying to convince me to stay on it. And at one point, he said, "You're probably going to need to be on this for the rest of your life."
Mm.
And I said, I went 36 years of my life without needing an antidepressant.
Yeah.
Why? I understand I have postpartum depression. Why would I need to be on one for the rest of my life? And it was only my determination that I'm not staying on this that I got off of it. And I have been fine since. I'm now 51 and I have not needed an antidepressant since I was 37.
Yeah.
But there is a really strong push in the medical industry to medicalize everything,
Yes. Yeah.
put people
I,
on
I
whatever
was
medicine.
shocked when my daughter was, I think, about 14 years old. And she'd gone to the doctor just for a regular checkup. And the doctor had her fill out this checklist. And the doctor came in and said, I think that your daughter's bipolar. And I'm like, what? And wanted to put her on some pretty heavy duty meds. And as you said, there's very appropriate times for medication. There are people who really do need to be on antidepressants. I think that childhood and adolescence is a very difficult time to determine that, because our bodies are changing, we are growing and developing, and so I would just advise caution and to be very discerning. And if you have a child who's just sort of having some struggles, that's not a time for an antidepressant. Antidepressants are very powerful. As the FDA notes, most of them are not approved for use in children. We don't know what the long-term impact's going to be, and we do know that these kids are not doing well. And I've had so many parents who have reached out to me and said, my child was on to antidepressants and then shortly thereafter started in with this transgender identity. And what's the core? They're wondering, is there something going on there? And again, we don't know. We don't have the research, unfortunately, but it's something to be aware of, the what antidepressants do and how that could set the stage for a child to be more vulnerable to the trans agenda.
And if you think about puberty, all of the things that are going on in your body, your hormones are changing, your physiology is changing, it affects you emotionally, psychologically. And when I was on the antidepressant, my psychiatrist said antidepressants deal with very sensitive neurotransmitters. And when I got off of it, he weaned me
Yeah.
very carefully over a long period of time because they have a profound effect on your body. I was a fully matured adult. My brain had finished developing and I still had to be very careful about how much I was taking and getting off of it. But you think about these children whose bodies are still developing, whose brains are still developing, whose they're going through the Tanner stages of sexual development. to become adults. And as you said, we don't know
Yeah.
what these drugs are doing. We don't know what's happening to their brains. As a parent, I would want to exhaust every other possibility for therapy, for treatment, before resorting to medication for my child. I would not make that my first go-to.
Yes, and actually, we have a clip that we're going to watch shortly that talks about the fact that most depression is caused by environmental factors or sort of external factors. That my mom had this idea that I was genetically programmed to be depressed, and a lot of people have this idea that being depressed is a lot like being diabetic, that there's nothing you can do about it, it's just your physiology. Just go ahead and take the meds. Well, if any psychologist had taken even a moment to look at my childhood, they would have identified bazillion things that could have set me up for depression. I had a tough time growing up. I had an early childhood sexual assault that was really quite brutal. My parents were divorced at about that same time. I moved from my home in California to Utah at about the same time, in with a new stepdad at about the same time. I mean, it was just like bam, bam, bam. There were all these things that were happening. I moved into a state where I was a minority. I moved to Utah and I didn't even know what a Mormon was. And that again set me apart. I lived with parents who had an open marriage, and that set me apart. I mean, they were drug users. So, I mean, there was just like, all these things that, one of them could have set me up for depression. And I had like a number of them.
I'm
And
so amazed that you're such a healthy, functioning, wonderful adult. You have come through so much. Anybody should be able to look at you and go, there's hope for
there's
anybody.
hope. Well, and I think, I can't tell you the pressure that I had from my mother to get on antidepressants. It just was this like constant, like, do you like being depressed? Just this sense of like, it was my fault that I was depressed. And again, I think that there are kids who get this message that, just buck up and be happy and take those medications because the parents are having a hard time being around a child who's depressed. And then, as a parent, I can attest to the fact that it's hard to be around kids who are having a lot of angst. It's hard to watch your kids struggle, but I think it's really important for parents to be cautious about antidepressants. And again, there are going to be some kids who really might need them. We're not medical experts, but my advice would be to be very cautious and again to note that for a while the narrative was that depression was genetic, it was biological, there was nothing you could do about it. But they're finding that in most cases there's a cause, there's a reason for that depression that can be resolved. So I think that it's interesting when I look at the narratives that the big pharma put out in order to promote their medications. A lot of times it is this idea of these meds are going to make your life so much better. There's nothing wrong with taking them. There's a reason that you need them. And it's similar to the opioids. I remember at one point there was this idea that was being circulated that if you were in pain all the time, you couldn't get addicted to opioids. It was sort of like if you had chronic pain, there was no risk because your body needed those opioids in order to get over the pain. Well, we've discovered that was wrong. And we have this
Who
huge
created that narrative?
Right, exactly. Yeah, you have to look at who's benefiting from people taking these medications.
Well, and I think things really changed when the laws were changed and medicine could be advertised.
Yeah.
When I was a kid, you never saw medicine pharmaceutical ads on TV. They were not permitted. And then when was it? In the late 70s or sometime in the 80s that suddenly that law was changed. Wonder why the law was changed. Lobbyists. And now pharmaceutical companies can advertise on TV. And so I think in the clip, one of the people's going to talk about how when you hear about diseases and disorders and you hear all about them, suddenly you think you have them. And so people are looking on TV and, oh, I'm sad. Oh, I'm sleepy. Oh, I don't feel good. I need to get whatever this drug is. And my husband has an aunt who works in health insurance. And I was talking with her one time about someone I know who is addicted to some controlled substances. And I said, how does this person get these? This is prescription. How does she get them? And my husband's aunt said, oh, you can get anything you want from a doctor.
Right.
You go in, you tell the doctor what you want. If you're insistent enough, they will give it to you just to get you out of their office.
Yeah, that was one of the things that I learned with my mom. She used to prescription shop. And I mean, I can't even tell you the numbers of bottles of different drugs that we had in the house, because she would just go from one doctor to another. And like you said, it was sort of a precursor to this whole affirmative care model, where patients were able to go in and get access to medications just by telling a doctor that they needed them. And it used to be that you'd have to, get fairly good psychiatric evaluation in order to be put on these meds. But now a lot of general practitioners will prescribe them, and they're really not qualified to do so. It's really, in my view, something that should be very comprehensive assessment should be done before somebody is, again, so that you find out, is there trauma in the past? Is there something that's causing this behavior? Is there abuse in the home? What's going on? And is this genetic, or are there underlying factors? So why don't we go ahead and watch that clip? It starts out actually with a detransitioner, this young woman who suffered from depression and thought that transitioning was going to cure her. Went through took cross-sex hormones and actually had a mastectomy, and then realized she was still depressed, that the transition initially seemed to help, but really ultimately it didn't. And I hear this over and over again among especially young women who they start the process, they feel really good initially, and then once they've done everything that they can do to transition and they realize the depression's still there, only it's compounded now because they see how much they've damaged themselves. So let's go ahead and watch this clip.
I feel like I'm always sad, and I hate that. And so I wanted to be forthcoming about what I'm going through and let you guys know that you're not alone.
So far, we have scientific evidence for 9 different causes of depression and anxiety. 2 of them are indeed in our biology. Your genes can make you more sensitive to these problems, though they don't write your destiny. And there are real brain changes that can happen when you become depressed that can make it harder to get out. But most of the factors that have been proven to cause depression and anxiety are not in our biology.
Something called the medical school syndrome, which, if you know people who have been to medical school during the first year of medical training, as you read through a list of all the symptoms and diseases that could happen, suddenly you realize you have all of them. What we're finding is it's not necessarily the reality that shapes us, but the lens through which your brain views the world that shapes your reality.
Well, Maria, that was really interesting. And it really resonates, that whole idea of when you read about a disorder, it's so easy to be like, oh, yes, I think that I might have it. And one of the reasons is that we're really good at sort of retrospectively looking at things to fit a new perspective.
People are pattern seekers, and there's a lot of research around why our brains are geared that way. But it's what lets us make sense of the world. We look for patterns and things.
Right.
And so that idea of, I'm going to do my research and try to figure out what's wrong with me. We're looking for patterns. What in my past, what behaviors have led to this? I had an issue, sort of a chronic ongoing issue, that I went to a doctor for when it first started happening. He told me, you are not to research this. Do not Google this. Do not go to WebMD.
Right.
I am telling you, I am taking care of this, and it is not a big deal. But if you go Google this, you're going to freak yourself out.
That's a really good point. And I think that, we have all this information to the internet, and we also have experts going into the school and talking about suicide and depression. And I think that one of the problems specifically around depression is that kids and teenagers have a lot of the, if you look at what is depression, it's really typical for teenagers to feel like they fit in that. And part of the reason is that they don't have the longevity of, so they don't have the sense of like persistently feeling down. Well, for a kid, that could be an hour. Whereas we know persistently feeling, down might be, 5 months, whereas for a kid it could be an hour. So their time frames are very different. Their sense of how heavy, how big things are, a lot of times is distorted because they don't have the experience in the world. They haven't grown up, they haven't had lots of life experiences. So say they've had a fight with their friend, that can feel like profound at the moment. Like they feel like they're gonna, like they want to kill themselves, like they want to die, like because things are so much heavier. And that's just sort of what's a normal part of being a child.
And that's what parents are supposed to be helping their kids through, is sort of providing that long view of what, this is not forever. I hear you. That's painful. This is really hard. It's not going to be forever. And just yesterday, I was talking with one of my daughters. We've been dealing with COVID for almost a year now. As we make this video, it's February 2021. And we've been pretty socially distant here in our family. We're doing it pretty hard. And I was talking with my daughter, and she made this comment. She's 15. And she said, I feel like if I can just suck it up and just get through life, and if I have to suck it up the rest of my life and just, be unhappy, that's okay. If I can just get to death and just suck it up. And I was like, I don't want you to live your life sucking it up. But we were talking about how a year in her life, a year for her is 1/15 of her life.
Which is a lot.
That's a lot. She's been in lockdown dealing with really scary, painful, difficult stuff for a year. For me, as I said earlier, I'm 51. A year is not that big a deal to me.
Yeah.
But this is really, you hit upon, I think, something that's really important. Stuff that adults tend to kind of dismiss and go, oh, that's just kid stuff. Oh, it's puppy love. It might be puppy love, but that's the first time that kid's experienced love. And that kid just got his or her heart broken and has never gone through it before. We need to help provide that. Yes, this is really painful. This is really hard. I promise that it's going to be better. It's going to get better.
And I think a lot of times kids are afraid of these big emotions because they are so heavy. And I think a lot of times the adults around them are afraid of these big emotions. And I'm not sure what's changed, but I feel like we have a generation of parents that are very nervous about kids being upset and having problems and being down, and they just want to like fix it. And so, and I don't know how much of that just has to do with our culture, or that we are so comfortable in society now that, we don't have to worry. Most people don't have to worry about, scrapping for food and finding a place to sleep. And if you have your basic needs met and don't have to be struggling about those, then I think it's easier to get focused on these emotions. I know when there have been times where I've been homeless and I've been dumpster diving, and I'm telling you, I'm not thinking about being depressed. I'm thinking about finding something to eat. And it's when you're in survival mode, it's very different. And I'm not trying to minimize people's feelings of depression because they're very real. And the other thing that I think is really important with younger kids, teenagers, young adults, is that there are things about their lifestyle that can contribute to them feeling depressed that are physiological, such as, not exercising, not eating well, not getting enough sleep. All three of those can really trigger what feels like depression. And when you're in it feels like depression.
And relationship too, connection. One of the things we saw in the video clip was loneliness, and we're lacking a lot of connection. Studies have shown one of the strongest predictors of kids being healthy and successful in life is eating dinner with their families regularly. Families just don't sit down to dinner anymore. I remember a few years ago hearing that now when they're building houses, building new construction, they're not putting dining rooms in houses because people just aren't sitting together in the dining room and eating. It's an unused room. And having those family connections is so important, and having meaningful relationships and friendships is so important. When I left my psychiatrist's care after the postpartum depression, he told me just what you mentioned. He said, you need three things. You need to be eating well, you need to be sleeping well, and you need to be exercising. And a lot of time recently, partly because we're in COVID lockdown, partly because this is just who I am, sitting at my computer. And I'm working on a book right now, and I'm spending a lot of time writing. I spend a lot of time in Zoom meetings. It's the dead of winter, so I'm not going outside much. Yesterday was a really hard day for me. Day before yesterday it was a very stressful day. And yesterday I just felt awful. And I needed to run to the grocery store because I'm doing groceries for my elderly neighbor lady. And I went to the store and I just sat in the parking lot in my car and I started crying. And I'm like, I don't even know what's wrong. Like, why do I feel this way? That afternoon, yesterday afternoon, my daughter and I walked down to the community center. There was something we needed to do there. And it's about a half mile, maybe 3/4 of a mile. Walking there and walking back, by the time I got home, I just had a new lease on life. Like, I felt better. I felt invigorated. I was like, oh, I haven't had any exercise at all in like a week.
Yeah. Well, and being outdoors too. I think that the combination of getting exercises and being outdoors, I feel like so many kids now are just like you said, they're on their computers, they're watching TV, they're really not getting outside much. And I think that we do better when we spend time outside. I think that it's really important for, that either, go for a hike or, and not everybody can do that. Some people live in places where it's not safe to be outside a lot. But I do feel like in a lot of cases, if you take a kid who's struggling, you get them to eat well, you get them connected with friends, you get them sleeping well, you get them exercising, you get them outside, they're going to just blossom. One of the reasons, again, that kids who are depressed feel better once they identify with, take on a trans identity is because all of a sudden they have friends, they have activities, they have connections. So you take a kid who's been kind of feeling alone and down, and all of a sudden they have this group that's affirming them and giving them affection. They're going to start feeling better. It has nothing to do with their identity as transgender. It has to do with the fact that human beings need those interactions, and teenagers especially need that connection with their peers.
Well, and we definitely need affection. We need approval. We need to feel important. And I don't want what I'm about to say to sound like parent blaming at all. There are no perfect parents. There are no perfect families. We're all trying. But if a child is not feeling particularly connected in the family, not feeling, loved and provided for, and that's not to say the family doesn't love them and provide for them, but your perceptions can counter reality. So I'm talking about the child's perceptions, so if the child feels like I'm not really connected to my family, my parents don't really think that much of me, they need that from somewhere. And what you said about getting it from the transgender identified community is really powerful. And I think that has been a strategic positioning that the trans rights activists have created. We talked in an earlier episode about the cultic aspects of transgender ideology, and love bombing recruits. That is the first thing that cults do to draw somebody in, because we desperately need someone to tell us they love us.
Yeah. And what I would recommend to parents, if a child comes to you and says that they're transgender, I would say talk to that child and tell them that you're willing to entertain that at some point, but that first you need to address the depression. And again, the kid may not be really happy about this, but make the case that, people who are depressed are advised not to make big life decisions. This is something that therapists say all the time. If you're depressed, you should, don't get a divorce, don't buy a car, don't move, don't quit your job. You need to get through the depression, and then you're ready to make these big decisions. Well, transitioning is a really big decision that's going to have lifelong implications.
Even
So
social transitioning,
even,
even just
yes, exactly.
changing your presentation, because
Exactly.
that affects all of your relationships. It
Right.
affects things moving forward.
And we know that once a child is socially transitioned, they're so much more likely to get on that path. So I think it's very reasonable for parents to tell a child, we need to deal with this first, this depression first. It's triage. You deal with, you don't, when somebody comes in, if they've been in an accident and they've got a broken leg and a gash that they're bleeding out of and they're not breathing, you don't go splint the leg. You get them breathing first. And if you can explain this to a child that you have to deal with the depression first, and don't put it off the table. Just say, once the depression's fixed, then let's talk about your gender identity. And I think that that's a very fair thing to do. And I would bet in almost every case, once the depression lifts, the child's not going to be as attracted to that whole transgender ideology.
Yeah, I think a big part of this is kids just looking for a fix. And I'm not talking about a drug fix, but I'm talking about a fix for what feels broken. Whenever there's something that we feel we're lacking, we feel something's not working, we're looking for the solution for it. And again, we're pattern seekers. So we're looking for patterns that tell us what is the right answer to this problem. And unfortunately, schools, social media, the culture, all of that is dumping on top of kids. The fix for every problem is gender. Every problem that you have, we can fix it by transitioning your genders. And that's ludicrous. That's absolutely ludicrous.
Well, and the thing that's so frustrating to me is that people within the trans movement even admit that oftentimes transition doesn't help with the depression. In fact, sometimes it makes it worse, rather than saying, well, maybe that's because transitioning isn't an appropriate treatment for depression. They make these claims about, well, it's because of transphobia, it's because you're not accepted, it's because of, all these external factors that these kids should be depressed because look at how bigoted society is. They're not allowed to use bathrooms, they're not allowed to compete in sports. They create this whole narrative to justify why the transitioning hasn't alleviated the depression, when in fact we know that it's because we need to cure the depression, and that transitioning is likely to exacerbate these problems anyway.
Well, and telling people, oh, the reason you feel the way you do is because society is treating you badly. And a couple of those things that you mentioned that are said are just completely untrue, that transgender identified children aren't allowed to use the bathroom at school. That is not true. No child has ever been refused bathroom use. They're asked to use the bathroom that corresponds with their anatomy. No child has ever been refused to participate in sports. They're asked to participate on the teams that correspond to their physiology. But yeah, telling children, oh, the reason that you feel this way is because society is so terrible to you. Well, that completely externalizes the problem. You have no ability to control or change what society is doing or what happens outside of you. You only can change yourself.
Right.
And if you put that locus of control outside of yourself, then everything becomes a blame game. And you don't have to fix yourself because you're not the problem.
I'm so glad you said that. I actually thought that one of the new diagnoses in the DSM-5 should be an external locus of control, because I feel like a lot of difficulty that kids have is when they feel like they don't have any control. And for those who aren't familiar with the term, there's this idea that if you have an internal locus of control, you feel like you can change things, you can make a difference. You control your thoughts, you control your feelings, and it's very empowering. If you have an external locus of control, you believe that everything's being put upon you and you don't have any control. So it's not that it's not that you can change your thoughts. It's that, people are doing things to you. And it's very disempowering, because basically you're at the mercy of your environment. And so it used to be that people really tried to encourage children to feel this internal locus of control. You can do it. You can change things. You don't have to listen to them. Well, things have really been flipped over, and now we're really encouraging children, especially, to give up that locus of control. And that's really that gives up so much. That gives up their sense of ability to change. And part of being human is that ability to change, ability to adjust our thoughts. And, one of the things cognitive behavioral therapy teaches is that you get to choose how you interpret something. So somebody can come along and say something terrible to me. Somebody could walk up to me in the street and say, "You're really ugly." And I can go home and be like, "Oh, I'm ugly. I'm ugly. That's just horrible." Or I can think, "Oh, that person's having a bad day." Or, "Oh, that person maybe has a mental illness." Or, "What are they talking about?" I get to determine how I respond to that. But this whole trans ideology is saying, no, you don't. If somebody misgenders you or uses your dead name, that's violence. You've just been damaged. You've been hurt. You've been attacked. That's a horrible message to give to kids. It's very disempowering. And we know that people who don't feel, empowered are more likely to be depressed. So it's sort of this vicious cycle of kids who are depressed being sucked into an ideology, which is encouraging them to give up their power, which is likely to increase depression.
Mm-hmm. Yeah, I look at some of the things that humans have overcome and have lived through. People have lived through real horrors. They've lived through enslavement. They've lived through long-term abuse. They've lived through concentration camps. They've lived through oppressive regimes, really violent experiences, and have come through it. And now we're teaching kids that, if somebody calls you she and you want to be called he, then that's violence.
Right.
No, it's really not. We've really shifted from a couple generations ago. I think the parenting was really tough love. Like, go out, milk the cow, work on the farm, and this is your life. And now it's this, I've heard parents say, "I don't want my children to suffer. I want them to have happy childhoods."
I'll do anything I can to make them happy. As if a parent has control over that, as if a parent can somehow make a child happy.
I know parents who don't believe in discipline because they don't want their children to be unhappy.
Yeah.
That is such a short-term goal that is so self-defeating, because we know, just like exercise, if you don't go out and stretch your muscles and push yourself, and when you exercise, you actually break down muscle and it hurts. That's why you're sore afterwards. It's not fun. But after that muscle heals, it's stronger, it's better, it's more powerful, it's more resilient. It's the same thing with our kids and with ourselves. We don't grow unless we suffer. We don't become resilient unless we suffer things that make us become resilient. And so wanting your child to have nothing but happiness and pleasure in life, you're actually dooming that child to never having happiness or pleasure in life.
You're really setting them up for failure. It would be like a parent who says, oh, you ran and your muscles hurt. Oh, well, don't run anymore. We don't want that. Oh, your gym teacher's making you run. Well, they're being violent against you. How dare them? I mean, that's really what this narrative is. It's so damaging. And we have a couple of questions from our listeners. The first one says, "My son isn't on antidepressants, but it seems to be making the gender dysphoria worse rather than better. I want to change his medication or even stop it altogether, but neither my son nor his doctor agree because they both buy into the transgender explanation for the dysphoria and depression. How do I convince them that this current medication is a problem?"
Wow, this really speaks to the locus of control, doesn't it?
It really does.
What are your initial thoughts, Erin? Do you have any?
Well, my initial thoughts would be to find another doctor. And I think it's okay to do that. I mean, these are your kids, and if you're uncomfortable with the medical care or the message that they're getting from their doctors, find another doctor. And again, I think this is another message that a lot of kids are getting, that they need this medication. They don't have control over their emotions. And in some very small cases, that's true. But in the vast majority of cases, kids, you can teach them to be resilient. You can teach them to get through their difficulties. But if you have a doctor who's saying, oh, you just can't handle life, you need this medication, that's again, that's taking away their locus of control. That's trying to make them really dependent on external forces. And I am concerned about doctors who, if a child's getting more depressed on an antidepressant, isn't going to take them off, because we just heard that the FDA says there's only one medication that's approved for depression in children. They know that, I mean, it says that these kids have to be watched really carefully because suicidality often increases on antidepressants. And so I think this parents' gut reaction is correct to get them off the medication. It is important not to just immediately take somebody off antidepressants, as you mentioned. They need to be weaned off of them slowly. So I would really encourage parents who are having this difficulty to find a doctor who's willing to work with you on getting your child off the medication.
And it also depends on how old the child is. If this is a young child and you still have control over their medical care, you have a little bit more power than you do with an older child. I was speaking with someone just the other day who had a similar issue trying to find a mental health caregiver, and was very uncomfortable with one that the child wanted. This is an older child. I think the child was in their 20s, but is still on the parents' insurance. And I asked, well, could you maybe tell your child, oh, this isn't a preferred provider on our insurance. We need to find someone who's a preferred provider. And she said, oh. Now, I shouldn't say most, I don't know. Many insurances, the mental health care coverage is very limited. This may not be a factor at all, but your child might not know that. How many teenagers, early 20s, really know how insurance works? So if you really need some sort of a way to get around it, that's a possibility, is just to say, oh, I've had this situation where our insurance company changed and a caregiver that I loved was no longer covered. And like, now I've got to find a new doctor. Yeah. So that's one possibility, one strategy to kind of say, we need to find a new doctor that's going to be cheaper with our insurance.
And if your child's older and is adamant that they want to stay on the meds, but you're really concerned about it, you can always tell them that you're not willing to pay for it. You're not willing to pick up the meds. I mean, you have to, I mean, this is very nuanced because, again, these are psychotropic drugs. You have to be very careful with them. So I do think finding a doctor that can help you wean off of them is important. But like you said, if it's a teenager or a young adult, your options are more limited in what you have control over. And your best bet might just be to be there to support your child in that case. So the next question that we have is, what does the research actually say on people who commit suicide because they aren't affirmed as transgender? Gosh, this is just one of my pet peeves. It's such emotional blackmail to tell parents that their kids are going to kill themselves if they're not affirmed. And it's also just a horrible disservice to put that message out there to kids, because we know, as the video said, when kids hear something, they start to believe it. And kids are going to start to believe that suicide is an appropriate response to not being affirmed, just because so many transgender activists are putting that message out there.
Well, this is emotional blackmail. And when I was a teenager, I had a boyfriend who I broke up with him, and he started calling me all hours of night and threatening to commit suicide. And I'd stay with him on the phone, or, okay, I'm all right. We can try again. We can try again. And this went on for months because I wasn't savvy enough to recognize this is not my problem. I get to make a decision about who I date, and it's not my problem that you're threatening suicide. Now, when it's your child, that's a much different case, but that is emotional blackmail. That is what that is. And there really is not research to back that up, partly because you can't do good research on who's going to commit suicide, because you can't have a control group. We're going to have this group, commit suicide.
Right.
Well, no, that's not ethical.
But the longitudinal study in Sweden does suggest that transitioning results in much worse outcomes as far as suicide goes. And I'd also like to point out, if your child came to you and said, you got to buy me a car or I'm going to kill myself, would you buy the car? Most parents would be like, no way. And so we have we have good sense about this when it comes to other issues, but for some reason this narrative has become so common that parents really are afraid of this. And it is a horrible thing. I've known parents whose children have committed suicide, and it's devastating. It's probably the worst thing that can happen to a family. It's just beyond heartbreaking. And so, this is a very scary thing. But again, there's that idea that if you have somebody who's suicidal, they're not allowed to make big life choices. In fact, they're not even allowed to consent if they're really suicidal. When you get checked into a hospital for suicidality, you lose your option to consent. You're not allowed to check out if you want to. You've lost that. And so if your child truly is suicidal, the last thing you want to do is complicate things with a new intervention. You need to get that fixed, get that depression, get that suicidality under control first, because really the idea that a child can demand to be treated a certain way under threat of suicide it's just no way to parent. I mean, you can't function in that.
And I know one parent who her daughter said, I just want to kill myself, I just want to die, and was in her bed with the sheets up overhead. And the mom went up to the girl's bedroom and said, are you thinking about hurting yourself right now? And the girl didn't say anything. And the mom said, I'm going to ask you again, and I want an answer. Are you thinking about hurting yourself right now? Are you feeling suicidal? And the daughter didn't say anything. And the mom said, I'm going to ask one more time. And if you don't answer me, I'm going to assume the answer is yes. And I'm going to take you to the hospital. Are you feeling suicidal, like you're going to hurt yourself right now? And the girl said, no, I'm not. Just leave me alone.
Well, and that's really smart to do that, because we know that if a child says, yes, I'm going to, I'm planning on suicide, then that's much more serious than a kid who says, I should just kill myself. It's a real different thing. And I've worked with people who are suicidal, and the doctors say, find out, ask them, are you going to hurt yourself? Do you have a plan? And if the answers to those two questions are yes, you get them to the hospital, whether they go kicking or screaming or not. It may be that they were just using that as a threat because they have been counseled to do this. We have activists who tell kids to threaten suicide. We have this documented. We have a therapist telling, that this is the way to get treatment. And so
that you want.
The treatment that you want. And so your kid, I mean, it may be, you might get there in the hospital, might be like, yeah, they're not really suicidal, but you can't risk it. If they say that they're going to kill themselves, then you have to take that threat seriously. But if they just say, oh, go ahead.
I was going to say, be aware that you're not putting an idea into their head. I think this is something a lot of parents are afraid of. I don't want to address this because I don't want to suggest it to them. Maybe they haven't thought about it. They've already thought about it.
Yeah.
You're not putting an idea into their head to ask, are you feeling suicidal? Are you feeling like you're going to hurt yourself? I just talked to a parent yesterday who has been seeing transgender-identified behaviors in her child for 2 years. And the child is dressing differently. The mom has seen things in the child's social media. She's talking about wanting to get on testosterone. It's very clear this child is pursuing this. The mom's afraid to talk to her about it. She's like, I don't know what to say. I'm afraid of what I'm going to hear. And she's just not talking to her.
Yeah, it's sort of like if a parent's afraid their child's pregnant and they just pretend it's not a concern. Well, if the child is pregnant in 9 months, you got to deal with it one way or another. And so,
come out some way. You might as well have it come out while you're sort of in control of the narrative.
Yeah, and I do think it's the other thing that I would really recommend, because I have dealt with people who are suicidal, and to be very specific, say, will you keep yourself safe until we talk next? Will you promise that you will not do anything until you know, your dad and I have a chance to talk with you tomorrow, and get those verbal contracts from them. That's really important, both for your peace of mind as well as, you know, for the dynamic, because people who really are suicidal need to be held accountable. So, so as a parent, you need to understand you did what you needed to do. So if the child does end up attempting suicide, you know, at least you did what you're supposed to do. And again, these are just horrible. You know, it just makes me so angry that the trans activists have introduced this into parenting. It's like parenting is hard enough without having to worry that your child might kill themselves because you don't affirm them. But it is, as you said, it's the worst kind of emotional blackmail there is.
Well, this has been quite a talk today. This was a heavy subject. I feel like every time we make a video, we say this was a really heavy subject. I hope we treated it well. I hope we didn't miss anything. If there's anything anybody who's watching has a question about, would like addressed, please go to partnersforethicalcare.com. You can watch all of our videos on there. The chat feature is always open. Someone's manning the chat lines, so you can get some help or some information there. Next time, we are going to be talking about Planned Parenthood and how Planned Parenthood has joined up with the gender identity industry. We are not doctors or therapists. We are not giving medical or psychiatric advice, and we offer no guarantee of outcomes. We simply want to talk about how to support and love kids using long understood best practices from the fields of psychology, education, and child development. We're glad you joined in our conversation today, and we hope that you took away something you can put in your toolkit for parenting your gender-confused kids with truth and love.